So hey guys, my name is Nick. Here at Crash and Learn, I'm one of the contributors with Heavy Lies the Helmet, and I'm actually in charge of safety and security for Crash and Learn this year here in Colorado, which is awesome. This is kind of my hometown. I work for an agency, Gunnison Valley Health, about 2.5 hours south of here. Very similar terrain. There's high deserts and rivers and ski resorts and everything. So when we had the opportunity that I could mesh both these worlds together and really kind of bring both groups of friends and family and my passion together, I was able to work with my agency, and we're a primary sponsor here for this event. I've got a bunch of my crew members here, and we're camping out, and they're attending sessions and networking and learning, and it's been a great opportunity for us. Not only, and it's easy to work with Heavy Lies the Helmet. I mean, I have some ins, but we were able to we have a truck here, and we're able to reach a huge crowd of people from all over the country, and which is awesome for recruitment. And also I'm retaining my people. It's huge for my agency to be able to send people to conferences. We pay them to be here, and we want them to be here. My medical director, Dr. Shay Creer, is even here camping with us, attending courses. I'll tell you what, if you want to get your medical director involved and there's something you want to do that they're not really into, this is a great place because they can meet other physicians and have that face-to-face. We're like, yeah, we did it here at our program, and here's all the things I was worried about, and I bet your medical director has the same worries. So being able to network in that way and grow your profession that way is huge. So Gunnison Valley Paramedics with Gunnison Valley Health, we're a critical access, government-based, basically third service, where we do everything from critical care transports and your normal run-of-the-mill 911 calls to backcountry work, and working with our SAR team, our search and rescue team, and a lot of the flight agencies that are here, I get to give patients to in places like this all the time. So it's awesome to bring it all together. And we're just really thankful for Heavy Lies the Helmet for letting us be a sponsor this year. So the river valley I live in, the closest main hospitals, like the big university centers, are 225 miles away. And it's not easy highway. So during the winter, there's tons of snow out here, traffic gets bad, people crash, and then we're trying to do these long-term transports, or we're stuck in the backcountry. It's not uncommon where we are to be out in the side country, the backcountry, and it just takes hours to access these patients and move these patients, right? And people deteriorate all the time. So we take everything from what we call an all hazards approach. And our philosophy is I want to put the highest level provider, and maybe that's a critical care paramedic, maybe it's a really good AEMT, whatever that is, to the point of injury of the patient or on that transfer. So we were the first ground ambulance here in Colorado to get waived to carry blood products. We're doing components right now until we can catch up logistically with whole blood. We carry T1 ventilators. We even have an EPOC on our trucks. So that way we can manage these patients just like the flight crews would manage them a long time. And what happens to us all the time is we get the super sick patient, and guess what? The weather's super, super bad. So we can't even get a fixed wing in. And so guess who's up to play is an ambulance with 4-wheel drive. And that brings together all the high-level clinical skills, but not just that, but crew resource management. I need to get the best paramedics and the best team to drive. So I'm going to put two critical care paramedics in the back. Am I going to bring another driver? Do we need to wait for weather? All the same kind of things you would do in flight. And I think really the 30,000-foot approach to that is nothing happens in a vacuum, and really our jobs across the modalities of transport aren't that different, right? We need to have the same clinical acumen, and out here, where I can't always get a flight crew to come swoop in and save our rear ends when things are going wrong, we have to be able to do the same thing. So raising that baseline level of knowledge to what the industry calls critical care, transport medicine is super important to our agency. If you're here at the event, I've got cards. Obviously, you're probably not here if you're watching this, but if you look up Gunnison Valley Health Paramedics or Gunnison Valley Paramedics in Colorado, there's a Gunnison, Utah. We're not that. We're in Colorado. All the information's there. If you find the number to the barn, you can always call any of the captains there, or if you know me on social media, I'm happy to answer any questions you have about our program.